Thank you, Mr. Chairman. This hearing provides an opportunity for me to highlight an economic opportunity success story in my hometown, which you just heard about in St. Louis. But before I get into that, I just want to say all of these programs being able to change the trajectory of someone's life. It changes not only that individual, but it changes their family, it changes their community, which means it changes our country. And I just want to say just thank you for the work that all of you are doing. But now I'm going to talk about Washington University in St. Louis, affectionately known as WashU, is located in my district. WashU provides a world-class education to its students, particularly its teaching hospital. Barnes Jewish Christian Hospital at Washington University Medical Center, a place where I've been myself multiple times, is the largest hospital in Missouri and the largest private employer in the St. Louis region. In 2018, the university launched a medical apprenticeship program offering training and opportunities to unemployed and underemployed members of the local community. Ms. Gladney, what prompted the Washington University Hospital System to start this medical apprenticeship program?
Thank you for the question. It truly came out of need. We had a number of openings at the time. We're having a hard time creating a pipeline where there were individuals who even thought of WashU as a place for this level of position. As I mentioned in my statement, a lot of people think of higher level titles and attribute that to WashU, not recognizing. So as we decided that there were a number of needs that we wanted to kind of grow our own, and attempted to walk down the path of how can we do that? How can we find individuals who might be underskilled, might be unemployed, might be underemployed, and give them an opportunity to have access to not only us as an employer, but all the rich benefits that we have to offer, including the tuition assistance. So it truly came out of those two needs.
And as a nurse who has worked in the hospital and in clinics, medical assistants. If we just talk about medical assistants, they are so needed and they don't get enough credit. And so thank you for filling a need in our community and for diversifying the healthcare workforce. Let me also ask you, since the program was established in 2018, is WashU able to fill its openings for medical assistants?
We are able to fill, but the need, based on the growth of the campus and within the region, the needs continue to grow. So even as of today, I have just short of 100 of these positions available. So the growth in the program has clearly helped. If I could expand the program, which is something that Ms. Clark and I have been discussing, that would be wonderful, but there are still needs that are outpacing the progression within the program. So there continue to be needs based on the growth of the medical school and their clinical enterprise.
Thank you. I am absolutely encouraged by these efforts. Healthcare, we know, is a critical industry, and hospitals everywhere struggle to find the trained staff that is needed to give the quality care to all of our patients. Washington University saw a need, just as all of you, all of our other witnesses, WashU built the infrastructure to fill those gaps. Ms. Gladney, how much do these programs cost the students, and is there an education requirement?
So the program is no cost to the participants. We rely heavily on our community partners who have backing from federal, state, and local funding sources to allow us to afford this opportunity at no cost. So they're making a wage, they have benefits, we have funding that helps to cover the programmatic cost, and also we partner with those same institutions to help provide for some of the other things that might be considered hindrances or barriers for our students. So if there are family care needs and getting access to affordable, whether that's childcare or elder care, transportation needs, in addition to providing a laptop, providing, proctoring the exam, paying for the exam. So there is no cost to the individuals.
Thank you very much, and I will yield back there.
Thank you. So votes.
All right.